Ovarian cysts, fluid-filled sacs on or within the ovaries, are a common health concern for women worldwide. Often dubbed a silent epidemic, they go unnoticed until they cause discomfort or a medical emergency. While many cysts are benign and resolve independently, others can grow, rupture, or cause complications, impacting reproductive health. The need for increased awareness and understanding of ovarian cysts, their causes, symptoms, and treatment options is crucial. Despite their prevalence, ovarian cysts remain shrouded in mystery and misinformation. This essay aims to shed light on this condition and empower women with knowledge to take control of their reproductive health. To grasp the significance of ovarian cysts, it's crucial to understand the ovary's role in a woman's body. These small, almond-shaped glands are the cornerstones of the female reproductive system. They produce hormones like estrogen and progesterone, regulating the menstrual cycle in pregnancy, and store and release eggs for fertilization. Hormonal fluctuations can sometimes disrupt the delicate balance within the ovaries. These disruptions can lead to the formation of cysts, which are usually harmless and resolve independently. However, some cysts can persist, grow larger, or rupture, causing pain and potential complications. Early detection and diagnosis are paramount in managing ovarian cysts effectively. While many cysts are asymptomatic, others can cause mild discomfort to severe pain. Understanding these symptoms and seeking prompt medical attention is crucial. Early diagnosis allows for timely intervention, preventing complications and ensuring the best outcomes. Diagnostic tools like pelvic examinations, ultrasounds, and blood tests assess the size, location, and nature of cysts. More sophisticated imaging techniques such as MRI or CT scans may be necessary for a detailed view. The female body is a symphony of hormones, each playing a role in the menstrual cycle and reproductive health. The ovaries produce estrogen and progesterone, influencing ovulation and preparing the uterus for pregnancy. However, hormonal imbalances can lead to ovarian cysts. Factors like stress, dietary changes, medications, and medical conditions can disrupt hormonal balance. Polycystic ovary syndrome, PCOS, is often associated with multiple small cysts on the ovaries. Functional cysts arise from the normal functioning of the ovaries, like follicular and corpus luteum cysts. These cysts are typically benign but can cause hormonal disruptions and discomfort. Understanding these hormonal missteps is key to managing ovarian cysts. Beyond hormones, other factors contribute to ovarian cyst development. Genetics, lifestyle choices, and underlying medical conditions play a role. Genetics can predispose some women to ovarian cysts, especially if there's a family history. Lifestyle choices like smoking and a poor diet can increase the risk of developing cysts. Smoking disrupts hormonal balance and irritates the ovaries, while an unhealthy diet can cause inflammation and hormonal imbalances. Understanding these factors can help in managing and preventing ovarian cysts. Some ovarian cysts can indicate a more serious underlying condition. Endometriosis can cause endometriomas, cysts filled with endometrial-like tissue, leading to pain and complications like infertility. In rare cases, ovarian cysts can be cancerous, making early detection and treatment crucial. Ovarian cancer, often called the silent killer, can manifest as a complex ovarian cyst. Certain infections like pelvic inflammatory disease, PID, can also lead to cyst formation. These cysts can cause pain and serious complications if left untreated. Diagnosing ovarian cysts begins with a comprehensive evaluation. This includes a thorough medical history review and a pelvic examination. The pelvic exam can reveal information about the health of the ovaries. During the exam, the healthcare provider assesses the size, shape, and mobility of the ovaries. This hands-on approach can identify enlargements, tenderness, or unusual masses. The pelvic exam helps differentiate between ovarian cysts and other gynecological conditions. Imaging tests play a pivotal role in diagnosing ovarian cysts. Ultrasound is the gold standard, providing real-time images of the ovaries. A transabdominal ultrasound uses a transducer to create images of the pelvis. A transvaginal ultrasound provides a closer view of the pelvic organs. Other imaging modalities like MRI and CT scans may be used for detailed characterization. These tests help healthcare providers assess the extent of the condition. Blood tests provide valuable clues about the nature of ovarian cysts. They detect elevated levels of markers like CA-125, which can indicate ovarian cancer. However, California 125 levels can also rise due to benign conditions. Interpreting CA-125 results requires careful consideration of the patient's overall clinical picture. Other tumor markers like HE4 may be assessed to calculate a risk score for ovarian cancer. Blood tests also evaluate hormone levels, shedding light on potential hormonal imbalances. The microscopic perspective reveals the diversity of ovarian cysts. Functional cysts appear thin-walled and translucent, while dermoid cysts contain tissues like hair and teeth. Endometriomas display a dark reddish-brown hue, indicating the presence of blood and inflammatory cells. This microscopic signature helps distinguish endometriomas from other types of cysts. Understanding the microscopic landscape of ovarian cysts is key to their diagnosis and treatment. Each type of cyst has unique characteristics, behavior, and clinical implications. The menstrual cycle involves the growth and maturation of follicles within the ovaries. Functional cysts, like follicular and corpus luteum cysts, arise from minor hiccups in this process. Follicular cysts form when a follicle fails to rupture or seals up after releasing an egg. Corpus luteum cysts emerge after ovulation when the corpus luteum fails to break down. These cysts are typically benign and often resolve independently. Understanding these near misses helps in managing ovarian cysts. Other types of cysts arise from more persistent cellular deviations. Cystadenomas, for instance, can grow large and cause discomfort. Endometriomas, associated with endometriosis, contain endometrial-like tissue and can be quite painful. These chocolate cysts can adhere to surrounding structures, causing pelvic adhesions. Understanding the different types of cysts helps in their diagnosis and treatment. Each type of cyst has unique characteristics and clinical behavior. In the realm of medicine, the decision to treat often hinges on a delicate balance between the potential benefits of intervention and the inherent risks it carries. When it comes to ovarian cysts, this balance takes center stage, as many cysts, particularly those of the functional variety, resolve independently without any need for medical intervention. In these cases, watchful waiting, a period of observation and monitoring, emerges as the most prudent course of action. This approach allows time for the body's natural healing mechanisms to work their magic, sparing the patient unnecessary treatments and their potential side effects. Watchful waiting, however, is not a passive approach. It involves regular checkups with the healthcare provider, often including repeat ultrasounds to track the cyst's size and characteristics over time. This vigilant monitoring ensures that any changes in the cyst's behavior are promptly detected, allowing for timely intervention if needed. During these follow-up visits, the healthcare provider also addresses any concerns or questions the patient may have, providing reassurance and guidance throughout the watchful waiting period. The decision to proceed with watchful waiting depends on several factors, including the cyst's size, its appearance on ultrasound, the presence or absence of symptoms, and the patient's age and overall health. Small, simple cysts, particularly in women of reproductive age, are often managed conservatively with watchful waiting, as they have a high likelihood of resolving on their own. However, larger cysts, those with complex features on ultrasound, or those causing significant symptoms may warrant a more proactive approach. Section 2. Taming the hormones. Medications as allies. When watchful waiting proves insufficient, or when ovarian cysts are linked to underlying hormonal imbalances, medications step into the spotlight as valuable allies in restoring balance and alleviating symptoms. Hormonal contraceptives, commonly known as birth control pills, emerge as a mainstay of treatment for many women with ovarian cysts, particularly those experiencing recurrent cysts or those associated with conditions like polycystic ovary syndrome or PCOS. These medications work their magic by suppressing ovulation, the monthly release of an egg from the ovary, which in turn reduces the formation of functional cysts. Hormonal contraceptives exert their effects by manipulating the delicate balance of hormones in the body. They typically contain synthetic forms of estrogen and progesterone, hormones that regulate the menstrual cycle. By providing a steady dose of these hormones, hormonal contraceptives prevent the ovaries from releasing an egg each month, effectively putting a pause on ovulation. This pause reduces the likelihood of follicular cysts forming, as these cysts arise from the follicles that normally develop during the menstrual cycle. In addition to preventing ovulation, hormonal contraceptives offer other benefits for women with ovarian cysts. They often regulate menstrual cycles, reducing the frequency and severity of painful periods often associated with conditions like PCOS and endometriosis. Furthermore, hormonal contraceptives can decrease the production of androgens, male hormones that can contribute to acne, excess hair growth, and other bothersome symptoms in women with PCOS. Section 3. The surgical path. Resection and Beyond. Surgery is essential for managing persistent or large ovarian cysts, especially when symptoms are significant or malignancy is a concern. The goal is to remove the cyst while preserving the ovary whenever possible. Surgery decisions involve careful consideration of risks and benefits. Laparoscopic surgery, a minimally invasive technique, has revolutionized ovarian cyst management. Tiny incisions allow a laparoscope to guide the removal of the cyst. This method offers smaller incisions, less pain, and quicker recovery. In some cases, a larger incision may be needed for better access. The cyst is examined and removed, minimizing ovary damage. The cyst is sent for pathology to rule out malignancy. Sometimes removing the entire ovary is necessary. This is considered for large, suspicious, or severely damaging cysts. The decision involves the patient's age, fertility desires, and health. Life after diagnosis and treatment. The journey with ovarian cysts extends beyond diagnosis and treatment. It involves physical and emotional adaptation, embracing a new normal. Many return to their routines reassured by follow-up appointments. These checkups ensure reproductive health and address concerns. Open dialogue with healthcare providers fosters empowerment. Some women face ongoing management with hormonal therapies. Support groups offer a lifeline, sharing experiences and resilience. Empowering women's health. Proactive care and self-advocacy are crucial in women's health, especially for conditions like ovarian cysts. Early detection and timely intervention can prevent complications and ensure the best outcomes. Women, empowered with knowledge, can recognize symptoms and seek prompt medical attention. Regular pelvic exams are vital for assessing ovarian health and detecting abnormalities early. These exams, often with pap smears, allow comprehensive reproductive health assessments. Lifestyle modifications like a balanced diet and regular exercise support ovarian health. A diet rich in fruits, vegetables, and whole grains, plus exercise, promotes well-being. Managing stress through yoga, meditation, or nature can positively impact hormonal balance. Understanding and managing ovarian cysts highlights the resilience of the female body. Open communication, early detection, and knowledge empower women to prioritize their reproductive health. Thank you for watching. Please like and subscribe for more content.